Hello friends, this is Council Vice President Gabe Abornoz, and it has been such an honor and privilege to serve on this council for the last 3 years. And what a 3 years it has been.
Gabe Abornoz.
I am so passionate about public service. I love this community. I'm born and raised here.
I serve as chair of the county's Health and Human Services Committee.
We've made tremendous progress in the vaccination rates.
Also serve on the Public Safety Committee. Drownings are the leading cause of death in children under the age of 6. I thought I knew a lot about Montgomery County before entering into this post, but I have learned so much over these last 3 years. And these last 3 years have been extraordinary and challenging in many ways, disorienting and tragic also in many ways. But they've also filled me with hope. I've seen our community step forward to provide food, to provide basic services. I've seen our public health officials heroically help protect all of us through their remarkable dedication and leadership.
Look at these guns, man.
And I want to thank all of our residents for your patience and your leadership in working with us as we've worked through this pandemic. What are some of the lessons learned, and how can we grow from this tragedy? We didn't have a playbook when dealing with the global pandemic, not quite in this way. And our social safety net was tested in ways that we had never expected before. I think what we've learned is that Montgomery County government cannot alone, will never be able to alone, serve all the needs of our county residents. We must do it in partnership and collaboration with our nonprofit sector, our private sector, and our federal government and state partners.
And we're sent, the mobile vaccine units in. We'll send a team in there. We've now got our FEMA mobile units that we're going to send teams out.
I also think that while we took for granted on some level the importance of public health prior to the pandemic, it is so critically important that we address the myriad of public health disparities that existed prior to the pandemic. I'm committed to doing so, and I believe working with our public health officials and our entire public health safety net, as well as our hospitals, that we're going to be in a better place coming out of this. We are in a time of uncertainty, and the variant is here, and of course schools fortunately reopened this week, and we have been so impressed with the incredible work of our Montgomery County Public Schools, our public health officials, and our independent schools as well for ensuring the absolute safety and security of all of our students. But we're all anxious. We don't know exactly what to expect as students have come back, because many of them have not been in the classroom for more than a year and a half.
I'm so excited.
The thing I'm looking forward to just to get back to the building after it feels like years.
It's gonna be definitely 10 times better this year being with my friends in the classroom.
And so we all need to be prepared as a community to help support their needs. We also have a lot of people who are continuing to hurt, and we know that there are a number of residents that are facing eviction, that have not been able to find gainful employment since the beginning of the pandemic. And so we're going to have to continue to step in and step up to support all of our residents, especially those most vulnerable. It is an honor to both be able to serve on our Health and Human Services and our Public Safety committees, because those are two foundational issues that we must provide for all residents. They have to feel safe. We have to ensure that those that are especially vulnerable have the support and infrastructure that they need to survive and thrive and to do well here in our community. And so it's been a real honor, and it's such an interesting perch to be able to sit on, to see how all of our issues are connected, but particularly issues around public safety and health and human services. And I'll give you two examples. One is around the issue of mental health. We put a lot of responsibilities on our first responders, sometimes too many of those responsibilities. They need assistance too to be able to fully and holistically support the needs of our residents. And so we've been intentional about connecting our mental health services and crisis intervention teams with our first responders to better respond to situations as they arise here in Montgomery County.
So the sister doesn't have a lot of information. She thinks it's schizophrenia.
Because we know those situations are often complicated and complex and have a lot of layers to them.
A police officer may call here and say, we have a completed suicide and the family is distraught, and we need you to come and be with them and offer them resources and make sure that they're safe too.
The other way that it's been helpful to be part of both committees is really underscoring the importance of positive youth development, something I've dedicated most of my professional career to. There's this intersection of ensuring high quality after school and summer programming for our youth while they are not in school, so that they can continue to learn and to enhance their social and emotional learning as well. So it's an interesting perch, and especially as we're addressing this moment in time we're in.
Black Lives Matter! Black Lives Matter!
In addressing issues of criminal justice reform.
What do we want? Justice!
It's a complex issue, also with a lot of layers, but it's an honor and privilege to be able to serve on both committees. You know, I'm especially optimistic that sometimes it takes a crisis for us to really be able to look ourselves in the mirror in a way that's authentic and that's sustainable. And my goodness, we've had to do that in spades this last year and a half. It really takes a true in-depth analysis and look and political will in order to be able to address these complex issues.
Thank you, buddy. Thank you.
You're welcome.
And I feel like we have some momentum in order to be able to do so, because we have to evolve as a government and as a community, continuing to have a very high bar of county government, which I believe we have here in Montgomery County, but build off of that and be nimble and flexible enough to address the growing and changing needs of our residents. Those things I'm optimistic about, because I think we can get those things accomplished and done.
So this facility has never been more important than right now. This facility is going to save lives. This facility is going to reunite families. This facility is going to keep families together.
I have learned so much in this last 8 months serving as vice president of this council, and I look forward to hopefully transitioning into the presidentship later this year. And I am honored and humbled to have had the support of my colleagues on the council. And I look forward to building off of the successes that we've had these last 3 years and really making sure that we continue to serve all of the needs of our county residents, especially those most vulnerable. I know these have been trying times, but I am confident that we have come out of this stronger, that we've learned from past mistakes, and that there is a very bright future for all of our residents here in Montgomery County.